Welcome back to Have More Babies, the show where we really get into the information you need right when you need it. Today, we're unpacking a topic that, well, for any parent, it can feel incredibly unsettling, maybe even frightening. We're talking about childhood dizziness and those really disorienting spinning sensations, vertigo in children. Our mission today for you is to cut through some of that confusion. We want to arm you with clear, vital information. This comes directly from a detailed guide shared with us by the pediatric experts at Omega Pediatrics. Because, look, the word vertigo might sound dramatic, almost like something from a movie.
It really does.
But its real-world impact on a child, it can be profoundly disorienting, isolating, and frankly, unsettling for the entire family.
And, what's often fascinating here is how casually people use dizziness and vertigo almost like they're the same thing.
In everyday conversation.
Yeah, I do that. But medically, there's a really crucial distinction. It's something parents should understand. Vertigo isn't just that sort of vague feeling of being lightheaded or maybe a bit woozy. It's a very specific sensation, often quite intense. The best way to describe it is a subjective feeling that your environment is spinning or moving around you, even when it's perfectly still.
Okay, so the room feels like it's moving.
Exactly. Or you might feel like you yourself are spinning. And critically, it's almost always a symptom. It points to an underlying issue. It's not really a disease in itself. Understanding that difference. That's really the first step when your child experiences this.
Okay, that clarifies things immediately. It's a symptom, a signal, which of course raises the huge question for parents. What causes it in kids? Our source lays out some common culprits, and this is where it gets really interesting because, like you said, some might surprise you. We tend to think of vertigo with adults, maybe older people, and inner ear stuff.
Right.
But it absolutely happens in children and for a whole range of reasons.
Indeed. When we look into the common causes for kids, the first one that often comes up is benign paroxysmal positional vertigo, BPPV for short.
BTPV, okay. Sounds technical.
It does sound complicated, but think of it like this. Deep inside our inner ear, we have these tiny calcium carbonate crystals, almost like microscopic pebbles. They help us sense head movements. In BPPV, these little crystals have basically gotten knocked loose. They float into the wrong part of the inner ear.
Oh, wow.
So when your child moves their head in certain ways, maybe rolling over in bed, looking up quickly, even just turning their head fast, these misplaced crystals send confused signals to the brain. Makes the world feel like it's spinning. It's often brief, maybe seconds to a minute, but it feels intense, very disorienting.
So it's like a tiny internal disruption when those crystals shift. What else is common?
Another significant cause we see is vestibular neuritis. This is an inflammation of the vestibular nerve. That's the nerve sending balance info from the inner ear to the brain. Super important nerve. And what's interesting here, and often missed, is that vestibular neuritis frequently pops up after a viral infection.
Really? Like a cold?
Exactly.
Yeah.
That common cold, the flu, even certain stomach bugs your child had. In some cases, they could trigger this inflammation afterwards. It's a real reminder of how seemingly minor illnesses can sometimes have these surprising knock-on effects.
That's a really important connection for parents to know about. Are there other main medical conditions involved?
Yes. Though it's much rarer in children than adults, we sometimes see Meniere's disease.
Meniere's, okay.
When it does happen in a child, it usually shows up as a sort of triad of symptoms. You get episodic vertigo, like sudden severe spinning attacks, and that comes along with fluctuating hearing loss and also tinnitus.
Tinnitus, the ringing in the ears.
That's right, a persistent ringing or buzzing sound. The exact cause isn't totally clear, but it involves an abnormal buildup of fluid in the inner ear. Again, important to stress, it's rare in kids, but it's on the list of possibilities.
That's a good overview of the main medical causes. But are there other things, maybe less obvious factors, that can bring on vertigo in a child? It sounds like it's not always just a classic inner ear issue.
Absolutely, that's a crucial point. Beyond those primary conditions, we definitely need to think about medication side effects.
Okay.
Certain medicines, maybe for allergies, ADHD, even some antibiotics, can sometimes cause dizziness or actual vertigo as a side effect. So it's always really important to review any meds, new or ongoing, if a child suddenly develops these symptoms.
Makes sense.
And another factor, one that's getting more recognition and often surprises parents, is migraines.
Migraines. I think of headaches.
Right, we usually think severe headaches. But many children experience what are called vestibular migraines. With these, vertigo is a major symptom, maybe even the main symptom. Sometimes they don't even have much of a headache with it.
Wow.
Yeah, imagine feeling the room spin, being super sensitive to light or sound, feeling really off balance,
Yeah.
all as part of a migraine episode. So the experience can be quite varied.
So it's not just the spinning, but triggers like meds or even a type of migraine.
That's definitely an aha moment for me.
Mm-hmm.
Understanding the why is key, but then there's the what. What might a parent actually see or
Oh.
hear from their child? What goes with the spinning? What are those accompanying symptoms that should be a red flag? Especially since, like you said, a really young child might not say the room is spinning.
That's such a critical question. An older child might tell you clearly, Mommy, the room is spinning, or I feel like I'm falling over. But a younger one, they might just seem really distressed, kind of out of it, or suddenly very clumsy, not themselves. So those accompanying symptoms are your clues. For instance, nausea and vomiting are really common. Okay. Like motion sickness.
Exactly like motion sickness. That profound imbalance just really upsets the stomach. You might also notice significant unsteadiness, real difficulty keeping their balance. They might stumble a lot, sway when standing, need to hold onto furniture, or even suddenly fall down. It's different from typical toddler wobbles. It's a sudden, noticeable change in coordination.
So a kid who's usually pretty steady suddenly seems like they can't walk straight. That's a clear visual.
Precisely. And beyond balance, sometimes there are hearing changes. This could be tinnitus, that ringing, buzzing, or roaring sound we mentioned, or even actual hearing loss. If you see those, it points strongly towards the inner ear.
Okay.
And finally, visual disturbances. Things like blurred vision, maybe double vision, or even those involuntary jerky eye movements, which doctors call nystagmus.
Nystagmus.
Right. The brain is struggling to match the confusing signals from the ear with what the eyes are seeing. It creates visual instability. So a parent might notice their child squinting, rubbing their eyes, or just seeming bothered by looking around. The main takeaway here is, if your child seems like they're spinning or just profoundly off balance, it's not just a dizzy spell. It's a signal their balance system needs attention, prompt attention.
Okay, so once these symptoms show up and a parent has that gut feeling something's really not right, what's the immediate next step? How do pediatricians figure out what's going on? Our source mentions standard procedures, but also some specialized ones. It sounds like they need to pinpoint the cause, since it varies so much.
Yeah, the diagnostic path usually starts with what we call standard procedures. First up is a thorough medical history. This part is so important.
What does that involve?
It means the doctor asks lots of questions. Understanding the pattern. When did it start? What seems to trigger it? How long does an episode last? What other symptoms happen at the same time? Any recent sicknesses? New medications? Parents often provide the most crucial clues right here.
Makes sense.
Then comes a full physical examination. This includes a neurological exam, checking the nervous system, reflexes, coordination, and also an otological exam.
Otological, ear-related.
Exactly. Looking closely at the ears, checking hearing roughly. The doctor might look for that nystagmus, those eye movements, or watch how the child walks and balances. And sometimes, if they suspect something structural, maybe inflammation or a nerve issue, they might order imaging tests, like an MRI or maybe a CT scan of the brain or inner ear to get a clearer look inside.
So it's like careful detective work, putting the pieces together. And beyond those standard steps, our source mentioned specialized tests. They sounded pretty complex. When do those come into play?
Right, those specialized tests often come in when the cause isn't obvious from the first steps, or if we need a really precise look at how the inner ear's balance system is functioning. One is called electronystagmography, or ENG.
Okay.
This test measures those involuntary eye movements, the nystagmus. It gives us vital clues about the health of the vestibular system. It's like a window into how the inner ear and brain are talking via the eyes. A similar, maybe more modern version is video nystagmography, VNG. It uses video cameras and goggles to track and record those eye movements very precisely.
So watching the eyes tells you about the inner ear.
In essence, yes. The eyes and the inner ear balance system are tightly linked. Specific kinds of abnormal eye movements can point directly to problems in the balance system. By watching their eyes, we're basically seeing what their inner ear is reporting, even if the child can't describe it well. These tools, ENG and VNG, are really vital for pinpointing the exact cause, and that diagnosis is what guides effective treatment. You really need to know what you're dealing with first.
That makes perfect sense. You need the right diagnosis for the right treatment. Okay, so diagnosis leads to treatment. What are the ways to help a child experiencing vertigo? It sounds like there's a range of options, from simple things, maybe even done at home, to more involved therapies, all depending on that diagnosis.
Exactly right. The treatment is very much tailored to the specific cause found. For something like BPPV, those Loose crystals we talked about repositioning maneuvers are often the first and honestly the most effective thing to try.
Repositioning maneuvers?
Yeah, like the Epley maneuver. It's a specific series of gentle head and body movements. The doctor or therapist guides the child through them. The goal is to literally guide those tiny crystals back into the part of the inner ear where they belong, where they won't cause trouble. It's amazing how well these simple physical movements can work.
Wow, literally guiding the crystals home. That's fascinating. What about managing the symptoms themselves, like the spinning and nausea?
For managing those acute, really distressing symptoms, the spinning, the nausea, vomiting medications can help. Things like certain antihistamines or anticholinergics can be prescribed. They help calm down the system, reduce the discomfort, and help the child feel more stable while the underlying issue is addressed or resolves.
Okay, so there's help for the immediate distress. What about longer-term support if it's needed?
Yeah, beyond just managing the immediate symptoms, physical therapy can be incredibly helpful. Specifically, something called vestibular rehabilitation.
Vestibular rehabilitation.
Okay, this involves a therapist guiding the child through a series of customized exercises. They're designed to basically retrain the brain to compensate for whatever inner ear dysfunction is happening. These exercises might gradually expose the child to movements that used to trigger dizziness, helping the brain adapt and get used to them. It improves balance over time, reduces the dizziness frequency or intensity, and it can really boost the child's confidence and ability to move around without being afraid of falling or spinning. It's very effective for many types of chronic dizziness.
That sounds really empowering for the child.
It really can be. Now, in very extreme, and I have to stress, truly rare cases, when other treatments just haven't worked and the cause is severe and debilitating, surgery might be considered. For example, a procedure like a labyrinthectomy, which basically disables the balance function in the affected ear, might be a last resort. But again, it's critical to emphasize surgical options are extremely uncommon for children, reserved only for the most severe, unresponsive cases.
It's definitely reassuring to know there are so many potential paths to treatment, from those simple movements to specialized therapy. But thinking beyond treatment, once things are stable, what about prevention? Are there things parents can do to, equip their child for better stability, maybe avoid some of these unsettling experiences? Can we make kids more resilient to vertigo?
That's a really thoughtful question. And while, not all vertigo can be outright prevented, especially if it stems from an unavoidable viral infection or an underlying condition, there are absolutely proactive steps that contribute hugely to a child's overall health and stability. They build a stronger foundation. One basic thing is ensuring a healthy, balanced diet. Seems simple, right?
Right.
But it helps rule out nutritional deficiencies that could potentially impact nerve function, including the nerves involved in balance or the inner ear. Sometimes subtle deficiencies matter. And alongside diet, regular exercise is just vital.
How does exercise help specifically with balance?
Physical activity helps kids develop and maintain not just overall balance, but also proprioception.
Proprioception. What's that exactly?
It's essentially the brain's internal map of where the body parts are in space without having to look. Think about closing your eyes and touching your nose. That's proprioception at work. It's your body's sense of itself. Regular exercise strengthens this sense, building a more robust internal balance system. It can make a child more resilient, better able to handle minor vestibular wobbles.
So it's not just general fitness, it's like building up their internal gyroscope.
That's a great way to put it.
Yeah.
Precisely. And of course, basic safety measures are crucial, emphasizing using helmets, other protective gear during sports, biking, skateboarding, even just on the playground. This can prevent head injuries. Head trauma is a known cause of vestibular problems because it can directly damage the inner ear structures or the brain's balance centers.
Right, protect the head.
So this raises an important point. While these things might not stop every case of vertigo, they really contribute to overall health and stability. They give kids a better foundation. They help build that internal resilience, making them potentially better at compensating for minor balance disturbances.
Yeah.
Maybe even before they become full-blown vertigo episodes.
Okay, so wrapping this up, what does this all mean for you, the parent or caregiver listening? Vertigo in children, it's undoubtedly unsettling. I mean, seeing your child disoriented, maybe sick, feeling unwell, it can feel incredibly isolating and frightening. But understanding the potential causes, knowing what symptoms to look for, and knowing when and where to get medical help, that offers immediate relief, just knowing what to do. And it provides a clear path to long-term solutions. It really empowers you to act, doesn't it? To be a better advocate for your child.
Exactly. That knowledge we've unpacked today, drawing from the expertise at Omega Pediatrics, it really empowers parents. Knowing what questions to ask your pediatrician, what subtle signs might be important, what the diagnostic process looks like, what treatments are out there, it makes all the difference in navigating this. It turns that understandable fear into informed action.
And for even more detailed information, lots of resources, and to explore comprehensive pediatric care options for your own family, we absolutely recommend you visit omegapediatrics.com. They offer a really thorough, caring approach to pediatric health, and the guide we've been discussing today is just one great example of their expertise and their commitment to helping parents.
Definitely check them out. And if you found this deep dive helpful today, please do take a moment to like this video and subscribe to our channel for more insights like this. Oh, and please share it. Share it with other parents who might be dealing with this or just want to be informed. It could really help someone.
Your support really does help us bring more crucial topics like this to light. We'll be back soon with another deep dive into topics that matter to families.